Please welcome Elaine Miller.
See, normally if you get the last spot, you're the headliner, but there's been some quite hard acts to follow today, hasn't there? It's been bloody amazing. I've made so many notes that I've had to completely rewrite my speech. So I'm not even joking, I have to kind of read this. So it's lovely to be here in amongst so many hateful bigots. I love this because I've been called a hateful bigot, and I'm like, have you looked at me? I'm a wee fat menopausal woman. How can you feel scared of me? Because I've got a brain. So, last week I was feeling really despondent, and then everything that's going on in politics, I was like, this is an insurmountable problem, and my attitude has changed somewhat after coming to Alloa, so thank you, because I've now decided there is nothing more terrifying on the face of this earth than a bunch of grey-haired women going, oh, do you bloody think so? Scottish women. Right, so I'm a fanny physio, and I know. I did think I would work in sports and get off with rugby players, but life's funny. So my job is, people come to see me if they've got problems with pelvic pain, if they've got prolapse, if they can't control their pee or their poo, if they've got problems post-pregnancy. So it's as if Sesame Street's bought me a career with the letter P. And my clinic days are usually spent elbow deep in leaky ladies, and I love it. I love it because incontinence is one of these things that nobody wants to talk about, let alone prolapse and vaginal atrophy and sexual dysfunctions. So that's why I thought, well, I'll try and make it funny. See if we can get women talking about it, because if you can make women laugh about something, then they'll talk about it, and that's how you share stories, and that reduces shame and stigma, and then you're more likely to take your fanny to the doctor. Which is quite important, because see if you're a bit pishy. She's saying, stop making me laugh then. This is a job creation scheme. I've got money bills to pay. So the evidence in this stuff is really clear. If you're a wee bit leaky around the edges, if you laugh or cough or sneeze, and you do pelvic floor exercises for 3 times a day for 3 months, 3/4 of you can be completely dry. Now, we've had that. That's not a joke. That's like actual science. That data was established in 1982. So you would have thought somebody would have told you. But they didn't. And the result of that is that the women who were my age in 1982 are now in their 80s and 90s. And those women have limited their lives because they're worried they're going to have an accident and they're going to be embarrassed. So they stop travelling. They stop wearing the clothes that they want to wear. They don't go on a bus in case they get stuck in traffic. They're actually brilliant to go on a city break with because they know where all the toilets are. Get one for foreign travel, but apart from that, tell everybody else that they need to go to the doctor. These women give up sex because there's nothing reduces your chance of having an orgasm than thinking you're accidentally going to shit in your partner's face. Now, in clinic, I would be a wee bit more careful with my language. But I'm a bit cross. Right, so these women who were 40, 50 in 1982, the consequence of not telling them, that's all bad, that's all to do with your quality of life, but the main thing that they do is they stop exercising. And coronary heart disease is the biggest cause of premature death in women in industrialized countries. So although people say, the budget holders and the health services say incontinence isn't that big a problem because it's not going to kill you, I've got evidence that it does. It just does it through secondary effects. The other thing that it causes is incontinence is the second most common reason for a woman to move into residential care. So first it's dementia, and then it's lack of bowel and bladder control. And we don't know how many of these women just had a simple birth injury 50, 60 years earlier. And maybe if we'd treated her, she might not have had to move into a home. Because usually what happens is she starts to worry that she's going to have an accident. So she goes to the toilet more often, starting by the time she's about 40. She stops drinking too much, apart from wine, because she's a middle-aged woman, you've got to drink. So she doesn't drink as much because that's going to reduce the number of accidents, she thinks. She goes to the toilet more often, just in case, and that reduces the amount of pee that her bladder can actually hold, so she has to go to the toilet more often. And then she starts to get urgency, which is you've got to go, but you've got to go now. So you start to run to go to the toilet, which is okay when you're 45. But when you're 85, it gets dangerous, especially if you're tired because you're up to the toilet 4 and 5 or more times in the night and it's dark and you're a bit stiff and sore because you're 85. And these women fall. And incontinence is a proven link to falls. And women who fall in their 80s, if they break their hip, then it doubles the risk of death within 12 months. So this stuff is awful. And we've had the answer to this for 40 years. But we just haven't told women, because, leaky old ladies, who cares about them? I'm so angry about it. There's nobody more derided in society, I think, than the smelly old woman. Nobody cares about her. Now, there's no need for her to be smelly. There should be somebody helping her with her personal hygiene, and the cause of her incontinence is treatable. But we don't notice her. And there's going to be thousands of us, hundreds of thousands of us. We could save a lot of money. We don't know how much money in Scotland because we don't keep any numbers. I did ask in Holyrood. But it's okay, because Westminster doesn't keep any numbers either. It must not be important. Australia did a big study in 2010, and they calculated that the total cost to their public purse for incontinence was $43 billion. Because they were smart, they didn't just add up the cost of the medication and pads and GP visits and surgeries. They included the falls, they included the coronary heart disease, they included the relationships that had broken down because the woman wouldn't have sex because she was anxious that something unspeakable was going to happen and she couldn't hide it from her partner, so it was easier to get divorced than be honest about the situation that she was in. Shocking. From a condition that we know is curable, 75% of you can sort it out yourself now. If it doesn't work, come into clinic, and 6 sessions with me gets 83% of you dry. I love my job. So the reason that this happens is often it's related to, having had a baby, having been pregnant, but not necessarily the case. Like the way that the government talk about incontinence is it's a thing that happens postnatally, but often it's when you become menopausal. So all that happens is because your body's estrogen thirsty, and your genitals in particular, once you stop producing estrogen so many in the high volume, then it starts to have an effect. And your pelvic floor, instead of being up where it belongs, swings a wee bit low, and you land up leaking a bit. So you would think it would be sensible to have some sort of vehicle to teach women about what menopause is and what it does. Because the only cure for menopause is a tragically early death. So presumably 51% of the population could do with this stuff. It's kind of important because we live for a long time. A baby girl that's born this year has got an average life expectancy of 90. And 1/3 of those little baby girls, if they're not born into poverty, of course, will live to be over 100. So that means that they have as many postmenopausal years ahead of them as they had premenopausal. And some of them might like to get a wee bit frisky. So we should be talking about the effects of menopause because it's a quality of life issue. Never mind a health issue. Never mind women live for a long, long time, mostly out of pure rage. Now, what happens at the moment is that we leave menopause education to Davina McCall, who's a national treasure, and good for her. She's done more for women's health in the last couple of years than anybody else has. Because she's, you know, a glamorous, fit, aspirational kind of woman, saying, yeah, and I take HRT, and I shag like a... They're doing another documentary, a follow-up one, because the response to her programme was so huge. And the producer got in touch. And I said, you know, the thing they don't talk about with menopause is the whole pissing yourself. That'd be quite good. And vaginal atrophy, nobody wants to talk about that. And she sort of coughed a bit and said, well, I'll talk to the producers. I'm thinking, you mean Davina. Because women don't want to talk about their fannies getting dry and uncomfortable, because it's a thing that, you know, the ideal woman, if you think about how patriarchal systems work, is not a woman with vaginal dryness. And they're not going to cover it in their new programme. I don't quite know what they are going to put in. There's plenty to talk about. There's 100 different symptoms of menopause, but I think vaginal dryness is the one thing that you could do a lot of good for public health with. So what happens is, so you've got all the tissue, right? You've got the tissue around your pee hole going up into your bladder, and you've got the tissue in your pelvic floor, and you've got all the bits around your genitals. And these all need estrogen. So when you become menopausal and it stops producing it, then they shrink a bit. So that's all fine and dandy. You know, if it's not going to cause you any great harm, except because of the shrinkage round about your pee hole, it means that you'll end up with a wider pee hole, which is why a lot of women land up with urinary tract infections repeatedly, which is a problem as you're getting older, because your menopause is already messing up your sleep, so you're pretty tired, and then you're still having to get up 4 and 5 times in the night, and that affects your mood, because you're shattered. So you go to the doctor and say, I feel terrible because I'm really tired all the time, and they say, would you like an antidepressant? Because you're crying. I'm quite sympathetic to the GPs, because they're presented with a woman who's sitting weeping, and they're like, I know what's wrong with you, you're sad. I'll give you a wee tablet that'll lift your mood and you'll be fine. And that's why lots of women come away from their GP not with a prescription for HRT, but for an SSRI to sort their mood disorder out. And I understand why it happens. These people only have 8 minutes with you, and you spent 4 of those not being able to talk, and the last 3 greetings. So, you know, they're doing their best. But having an SSRI, an antidepressant, is not going to address the cause of your mood. The cause of your mood is loss of estrogen. For many people, you know, there are, you know, psychological causes where a different medication would be appropriate. Now, the problem with that is that if we don't tell women that mood disorders and anxiety are linked with menopause, and we also don't think the average age of menopause is 51, and the average age of a woman taking her own life is 51. Why do we not have a vehicle to tell women that menopause is going to happen to you? It might not be that big a deal. For about 1/3 of women, you just sail through it, it's absolutely fine. For about 1/3 of women, you've got a bit of a nuisance, but you manage that just by getting rid of the duvet and stripping a change of pyjamas, and it's all fine, it disappears off. And for 1/3 of women, they're actually disabled by their symptoms. And they don't know that these are just hormonal symptoms. They just feel bad about themselves for being inadequate. So I think it would be quite good if we could land up with a documentary that would cover this stuff. But I'll start emailing people quite soon. That's also a symptom of the menopause, sending emails. As you well know. So the average age of menopause is 51. If a woman is under 45 and she starts to have symptoms, she's offered HRT because there's a protective element against the consequences of an early menopause, which would be an increased risk of cardiovascular disease, so heart attacks and strokes, an increased risk of dementia, and an increased risk of osteoporosis. And it's important that that gets picked up for women with early menopause. So what I'm interested in about that is, if we know it's important for a woman who's comfortable with her femaleness, what is the protective element of gender? in a 19-year-old female person who goes on testosterone, what protects that person's body against the known effects of an early menopause? Cardiovascular disease, dementia, and osteoporosis. Now, I asked that question at a conference of a gender clinician that works at the NHS unit. And because I know the answer is we're putting these young female people into menopause 30 years early, and it's going to have an effect. And what the consultant said was, I know, but by the time they come to clinic, they're already on testosterone and we can't get them off. And I thought, well, you could try. You could try saying no. You could try getting the waiting list down, because Stonewall has quite a lot of money. And Marie Todd's just pledged £9 million for trans care, so there is quite a lot of money sloshing around that we could try and get these waiting lists down so that these people are not sloshing around for 4 years on the internet, learning how to buy testosterone in the black market and taking it without medication, without advice, and without a diagnosis. But no, they're not doing that. They're just going with it because nobody says about the science to these people. And I don't think that that's okay. So my problem with this is that there isn't actually research into what will happen to these people, because you're not allowed to research anything other than this is smashing. But we do have models from the 80s when athletes, Olympic athletes, were doped against their consent by Eastern Bloc countries. So these young women who were Olympians, they're at the peak of physical fitness. You can't get fitter than an Olympian. And they gave them steroids, anabolic steroids, to improve their performance. And a lot of those women died prematurely. Sharon Davis speaks very eloquently about this, about the women that she competed against who died in their 30s. And a lot of the time, we don't know for sure because it's Eastern Bloc, but there does seem to be an unusual spike of these people that have taken cross-sex hormones who are dying prematurely of heart-related conditions. And it would be quite nice if somebody would maybe do some research into that, because I care about these people that say that I'm a bigot and that I'm a hateful person for saying, hod the bus. I would rather that they didn't die. I would rather that they had a healthy life and could be as happy as they possibly could be, because I'm a mum. That's what mums want. We are the mothers of this generation, so them calling us hateful bigots just sounds like teenagers. And I have 3. So have your temper tantrum. I'll say no anyway. Now, my worry with the trans men and the non-binary female people taking testosterone actually isn't so much for them, because assuming that they're an adult, they're making a choice, and adults should be allowed to have choice. But if these people then decide to have a baby, I've got an issue about the science behind that. Now, there's one trans man who's very helpfully curating the pregnancy of their little baby that they've just had on Instagram, which is really useful because it kind of backs up the papers that I've been looking up recently. So if you take testosterone over a period of time, it causes permanent changes in a female body. So people don't lose their facial hair. A lot of the detransitioners have spoken about the permanent changes that they have. So why would we assume that a uterus, which has been put into a menopausal state, would rejuvenate itself just because you fancy having a baby? There's lots and lots of research looking at what happens to menopausal women who get pregnant. Brace yourself, ladies, it does happen. You've got to be careful out there. And women of an advanced maternal age is the polite term, which is over 35, by the way, the cheeky feckers. But once you get to 45 to 50 years old and you're pregnant, your uterus does not work efficiently. It does not produce a placenta as efficiently as it would have done 20 years earlier. So it's very common for these women to need extra monitoring because they're more likely to have a small baby, they're more likely to have a premature baby, and they themselves are more likely to have preeclampsia and high blood pressure and all of these things. So there's extra care put in place for these women. Doesn't seem to be the case for the trans men. And yet this person who's been so very diligent, but that must be the journalist training, on Instagram has put a photo yesterday, in fact, of the placenta of this little baby that had to be born at 35 weeks in quite a traumatic birth, and I'm sad for this person because it must have been horrible. But that placenta is about the size of my hand. Now, I'm not an obstetrician, I'm not a midwife, I've only seen 3 placentas up close, and they were massive. So if you've got a baby that's born early, and you've got a body that's full of testosterone, I wonder if that's linked in some way. And maybe if these people, I'm not saying that people shouldn't have babies, I'm saying we need to look after them because you can predict that that infant is going to have problems because of prematurity. Also, if this testosterone stays in your body and you have a little girl, baby girls are born with all of their ovary eggs inside them. If you're pregnant with a girl, you're carrying what will become your grandchild one day. So there's an intergenerational problem here as well. What happens to that little girl as she grows up? Is it going to have an influence that her body was suffused with testosterone in utero? Well, we don't know, and nobody seems to be really interested in finding out. But we do know that if a woman's got polycystic ovaries syndrome, so she's got higher testosterone normally, those women are more likely to have miscarriage, baby loss, and premature births. So I think there probably is a wee bit of science there that we should maybe be keeping an eye on, but nobody's doing that. They're just waving rainbow flags around and saying, isn't this lovely? I think if somebody gets pregnant through the care of a fertility clinic, they get pretty decent care because somebody's keeping an eye on them. But if they get pregnant on their own, which can happen, lots of people are not going to gender clinics. Most people, or a significant number of people, certainly in the States, are self-medicating. So if they just come off their testosterone till they get pregnant, and then they go back on it the instant the baby is born because they feel that they need it, and I'm respectful of that. But once the baby's delivered, there's a whole cascade of hormonal changes happens in the mother's body. And it's for a reason. It's to make you think that this screaming, shitting, ugly little thing, I mean, my babies were the most beautiful babies the world had ever seen. I genuinely didn't understand why people weren't stopping me in the street and saying, can we use your baby to sell our stuff? Because that baby is just a light in this world. And see now, looking back, they were gremlins. Ooh. You know that way that somebody says, oh, your baby. What tiny hands. That means your baby's a munter. But you don't see it because you're full of oxytocin because the hormone makes you think this infant is just the center of the universe. And the baby needs you to feel like that so that you bond with it, because children that don't get attachment have problems later on in life. So it'd be really interesting to know what happened if a person who identified as a father had a baby and then instead of allowing this hormonal cascade to take place, started taking testosterone, which doesn't really belong in high levels in a female body. I'm assuming it will have an impact on the mother-baby dyad, and maybe we should have a little look at that because this infant didn't consent to this. So, Andrea Dworkin said that feminism is for all women, including the women that you don't like. And I think that probably today we need an addendum to that, which is including the women who don't like us. Because I see these trans men and non-binary identified people with uteruses as my sisters. And I know they don't like it, and I know it upsets them, but they can't escape their biology. And I have hardcore evidence that says that they need it. They need this information because it's going to make life hard for them, and I'd like it if they didn't have a hard life. Now, I had a paper that I presented at the House of Lords that was about the other end of life, about dementia. And it's from a few years ago. It's a Canadian paper. They did a literature review about what happens to people who are trans-identified and they also develop dementia. And some of them forget that they've transitioned, which is really interesting because I've worked in elder care and I have never yet met an older person who develops confusion, who changes sexuality. That doesn't seem to be a thing. You don't forget that you're gay, you don't forget that you're straight, you don't forget that you're bi. Your behaviour might change. You might become disinhibited and a bit of a problem in the nursing home because you keep hopping into bed with people that can't get out. Which is why I think I'll open up a women-only nursing home quite soon. But they don't forget because sexuality is innate, and there's the proof. The proof is also heterosexual women that have been married to the same man doing their nutting for 20 years. There's no other explanation for that, is there? So why Stonewall says that gender is innate, I don't know, because it would seem that there's no evidence for this. If we've got a literature review that's a comprehensive and really quite good literature review telling stories about people like this person who was 80 when they transitioned into being a woman, had the surgery, and by 90 had completely lost all sense of reality, was in care, and woke up every day distressed because where are these breasts? Why am I wearing the wrong clothes? Those should be my clothes. Every day. It's like something out of a Greek myth. And there's nothing you can do about that because that person is now no longer fit enough for surgery to have the breast removed and cannot consent to the surgery. It is cruel. So if people detransition through dementia, then we have a problem in Scotland. Because if that person also has a gender recognition certificate, this person would legally be female. Now, if they're living in residential care, most of the people that are working with that person are female. They're not unionised. A lot of them have English as a second language, and they're working 0-hour contracts. So they do not have secure employment to say, I know that your name on your bit of paper says Betty, but I'm going to call you John because I'm good at my job and I'm providing person-centred care, and I'll dress you in trousers and I'll call you by your name that you prefer. Because in Scotland, that good carer providing good, excellent person-based care is breaking the law. That is a hate crime. So when the consultation was going on in January, I sent my paper in and I explained about, I'm concerned about this. Have you considered the impact on these workers who are vulnerable and who need the work and have very little in the way of protection? And I worked really hard on my submission because I hadn't actually done something as formal as that before, and also I didn't want to get it wrong and look like a dick. However, happily, they rejected my submission because I didn't format it correctly. So you know how they put it up? And I was looking online and it wasn't there, so I've emailed into the clerk, oh, you know, where is it? It's not there. We've rejected it on the basis of format. I don't actually really know what formatting is. I just know I did it wrong. So I emailed in again and said, but I'm not a lawyer. I'm not a parliamentarian. I'm not a civil servant. So surely there must be some leeway in the formatting because what I am is quite well educated and evidence-based. So if you're rejecting my submission on the basis of format, and you're also excluding all the citizens who are dyslexic or who don't have my level of education and are just trying to participate in the democratic process, and I didn't get a reply. So that is why I thought, oh, do you bloody think so? And I sent it to the House of Lords, which is how I landed up presenting that paper at Baroness Nicholson's webinar. Yeah. But it made no difference. You know, the law's coming in, we've got these debates, so I think I need to just stop trying to work within the system. I think I need to do what Magdalene Byrne said and be brave and stop trying to toe the line because they're not going to listen to me. But I've got a big voice. So thank you very much for listening to me because I think this stuff is important. I hadn't realised how important it was to me until I was listening to some of the earlier speakers, and I've got this stupid fancy watch that my husband bought me because he loves me and he wants me to keep living by moving and exercising, dearie me. And it measures your heart rate, right? And see, sitting up there, my heart rate was going at 137 beats a minute on pure rage. Now, the interesting thing about women's anger is it makes us cry. I've seen women in tears all day. And it's not sadness, it's not upset, it's not that you need a wee SSRI or HRT, it's you are angry. And women's anger is really interesting because it's taboo. You know, men get angry and they go around punching stuff and committing terrible crimes and land up in the jail, and fair enough, testosterone's a hell of a drug. But women do much more interesting things with their anger. They find other women and they pull together and they talk about it, and then they build shit. You've heard it today. They build stuff. Women's anger is productive, it's not destructive, and that is why these politicians are going to have a problem. And it's also why medicine is going to have a problem, because it should be based on first do no harm, and I am not convinced that they're actually doing that. So, thank you very much for listening to me. I could go on, but apparently the bar's opening. And I need to say, actually, if you're a healthcare professional, everything that I've spoken about, I've got a PDF with references on it. So if you would like some CPD for your reflective practice, I'll send you it. You're very, very welcome to use it and get CPD points, because I think that will work going within the system. Thank you very much to Forth Valley. It's been an amazing day.